Hello, I'm Dr. Adam Robinson, the Director of the VA Maryland Healthcare System. As a physician and as a 35-year Navy veteran, I would like to thank you for enrolling in our healthcare system. We are committed to providing safe, quality, and compassionate care to all veterans through a concept of care which is patient and family-centered and incorporates our core values of integrity, commitment, advocacy, respect, and excellence. As a new patient, you will undoubtedly have many questions about your care and how to access our programs and services. This video will provide an introduction to the VA Maryland Healthcare System, the services available to you, and the best way to access each of them. I encourage you to watch each of the modules and learn how to navigate our system. If you have questions, and I'm sure that you will, please do not hesitate to contact us at the phone number shown throughout the video. On behalf of our dedicated employees and our volunteers, I welcome you to the VA Maryland Healthcare System, and I thank you for allowing us to serve you and your healthcare needs.
I'm Kenya Griffin with Public and Community Relations. The Veterans Affairs Maryland Healthcare System is dedicated to providing safe, quality, and compassionate care to the veterans it serves. The system is comprised of several sites throughout Maryland with a team of 3,000 professional, technical, administrative, and support staff, all working together to form a comprehensive healthcare delivery system. More than 1,200 community volunteers supplement this workforce. Services throughout the system include medical, surgical, rehabilitative, neurological, primary, mental health, and long-term care on both an inpatient and outpatient basis. Through a close affiliation with the University of Maryland School of Medicine, veteran patients of the VA Maryland Healthcare System have access to some of the latest clinical practices and procedures available. Additionally, the VA Maryland Healthcare System is a member of the VA Capital Healthcare Network, which includes VA medical centers in Washington, D.C. and West Virginia, allowing veterans to benefit from the sharing of staff, resources, and services across these medical centers. Nationally recognized for its outstanding patient safety and state-of-the-art technology, the VA Maryland Healthcare System is proud of its reputation as a leader in veterans healthcare, research, and education. Thank you for allowing us to serve you, and welcome to your VA Maryland Healthcare System.
Hello, I'm Sherry Early from Medical Administration Service. Now that you've enrolled with the VA for Healthcare Services, your first step is to schedule an appointment with a VA primary care provider. The VA Maryland Healthcare System has 9 sites throughout Central Maryland and the Eastern Shore where you can schedule your VA primary care appointment. You can choose a location that is closest and most convenient for you. To schedule your appointment, please call the Appointment Call Center at 1-800-463-6295, extension 7333. If for any reason you cannot make your scheduled appointment with us, we encourage you to call the Appointment Call Center to change or cancel your appointment as soon as possible, but please at least 24 hours before your appointment time. When you do not call in advance to change or cancel your appointment, we are not able to give that appointment time to another patient, which can lead to longer wait times for your fellow veterans. So please do not be a no-show for your appointments by calling to cancel or change your appointments as soon as possible. Once again, to schedule, change, or cancel your appointments, you can call 1-800-463-6295, extension 7333. All veterans who enroll for VA healthcare are assigned to one of 8 priority groups based on certain factors like your service-connected disabilities and income level. This rating system helps ensure that VA resources are allocated to veterans with the highest priority for VA care, with priority group 1 being the highest. There is no monthly premium required to use VA healthcare. However, you may have to agree to pay some co-payments based on your priority group and income level. If you have insurance, it may cover the cost of the co-payments. In addition, VA is required by law to bill your private insurance carrier for any care you receive from the VA that is not related to a service-connected condition. Hello, I'm Sherry Early from Medical Administration Service. The VA Beneficiary Travel Program provides eligible veterans and other beneficiaries support for their travel to and from a VA healthcare appointment or VA authorized care in the community for which the veteran is eligible to receive. This includes mileage reimbursement, reimbursement for travel by standard public transportation, which includes plane, train, bus, taxi, light rail, etc., and specialty transportation may be necessary to accommodate the veteran, like an ambulance. To be eligible, you must meet one of at least 5 criteria: a service-connected rating of at least 30%, traveling for treatment of a service-connected condition, receiving a VA pension, income not more than the maximum VA pension rate, or traveling for a scheduled compensation and pension exam. Additionally, if you meet one of these criteria and your VA clinician has determined your medical condition requires an ambulance or specially equipped van, you may also qualify for special mode transportation. This travel will need to be pre-authorized unless it's an emergency. To apply for travel reimbursement, you must complete the Veteran Beneficiary Claim for Reimbursement of Travel Expenses, VA Form Number 10-3542. You can obtain this form online at maryland.va.gov and search for form number 10-3542. Once the form has been completed, you can call the Beneficiary Travel Office to schedule an appointment to submit the form in person, or you can mail or fax the form. If you have any questions, you can call the Beneficiary Travel Office for assistance. Once again, that number is 1-800-463-6295, extension 7318. And thank you. We can't wait to see you here. Hello, I'm Sherry Early from Medical Administration Service. Once you have your first VA primary care appointment scheduled, please plan to arrive at least 30 minutes early. If for any reason you cannot make your appointment, please call the appointment call center at 1-800-463-6295, extension 7333. On the day of your appointment, please bring the following items with you: a valid picture ID. It can be a license, it does not have to be a VA card, and your insurance card or insurance information. We also recommend that you bring a list of all medications you are taking, including over-the-counter medications and supplements with the dosage amounts and frequency, or you can just bring your medication bottles with you. Please also bring copies of medical records from hospitalizations in the past 2 years and copies of any recent test reports like x-rays, EKGs, stress tests, echocardiograms, cardiac catheterizations, blood, urine, etc. When you arrive for your clinic appointment, we will ask if any of your information has changed, such as your address, telephone number, financial information, etc. At least once every 6 months, we will also verify your health insurance. If any of the information has changed, we will take your card to scan it and return it to you. When you check in for your appointment and all future appointments, it is important to make us aware of any changes in your mailing address or telephone number so we may know how to reach you. You can also call the Enrollment Center to make us aware of changes to your contact information, or you can let the clerk know when you check in for your next appointment. It is also important to inform each branch of your VA of any changes to your contact information, such as the Veterans Health Administration, the Veterans Benefit Administration, and the National Cemetery System. Keeping your information accurate allows the VA to better inform you of updates to benefits and services. Once enrolled with the VA for healthcare services, you must be seen by a VA primary care provider at least once every 2 years to maintain your enrollment. In other words, to be considered active in the VA healthcare system. Thank you. Hello, I'm Sherry Early from Medical Administration Service. Veterans enrolled in the VA healthcare system are issued a Veterans Health Identification Card. The purpose of the card is for identification and check-in at VA appointments. You should always carry your card with you when you visit a VA Maryland Healthcare System facility. It will get you in the parking garage at the Baltimore VA Medical Center, and you'll be asked to show your card upon entering any of our buildings. At some facilities, you can also use your card to check in at the kiosk instead of going to the reception desk. You just swipe your card and follow the directions on the screen to check in for your appointment. The new card is designed with enhanced security features. It uses a member ID and card number instead of your social security number. You will need to provide 2 forms of identification, such as your driver's license or passport, and have your photo taken. The card will then be mailed to you within 7 to 10 days. The VA Maryland Healthcare System does not issue Veterans Health Identification cards. They are mailed from a central VA office in Atlanta, Georgia. If you lose your card, you can request that another one be mailed to you. You can call 1-877-222-VETS or 8387. Once again, that number is 1-877-222-VETS, and they will be happy to issue you another card. Thank you.
Hi, I'm Dr. Martin Garcia, primary care physician. Your VA primary care team is the bedrock for your VA healthcare. If you are newly enrolled with the VA Maryland Healthcare System, your first step is to schedule an appointment with a VA primary care provider. You will be joining a PACT, a patient-aligned care team that includes you, a physician or nurse practitioner, a nurse care coordinator, a licensed practical nurse or health tech, and an administrative support person. Your PACT is rounded out with a social worker, a behavioral health specialist, and more depending on your individual needs. We offer preventive care, routine care for acute illnesses, and the management of chronic illnesses in an outpatient setting. Your PACT collaborates with any specialty care services you may require. While most services require referral from your primary care provider, there are some that you can self-refer to, like audiology or optometry, and all mental health services. If you're a female veteran, you should know that we now provide specialized women's care, including the coordination of maternity care. We follow a model of whole health, veteran-centric care. We want to get to know you and become your medical home. We're here to support your wellness with health and medical education, answer your questions, and listen to your concerns. We're here to help you take good care of yourself. With 9 locations where you can receive your primary care services in Central Maryland and the Eastern Shore, we encourage you to visit the location that is most convenient for you. Through preventative care and emphasis on wellness, our goal is to keep you healthy so you don't end up in a crisis situation and needing a trip to the hospital or emergency department. Please remember, for all medical emergencies, call 911. Thank you so much.
Hello, I'm Zelda McCormick, Women Veterans Program Manager for the VA Maryland Healthcare System. Our Women's Health Program promotes the health, welfare, and dignity of women veterans by ensuring access to timely, sensitive, quality health care. We have designated women's health providers who are proficient in providing primary and gender-specific care to females. We also offer on-site 3D mammography services, and we have in-house gynecology services. In the VA, you can get your primary care and your gender-specific care from the same provider. That's not always offered in the community, so the convenience and the continuity is there. The VA Maryland Healthcare System consists of 3 inpatient facilities and 6 outpatient clinics that are located throughout Central Maryland and the Eastern Shore. Veterans who are eligible for VA health care can receive their care at the site that is most convenient for them. On the screen, you will see a list of comprehensive medical services that are available through the VA for women veterans. There are some services that eligible veterans are entitled to that we don't offer at VA, such as maternity and infertility services. Veterans in need of those services would be referred to our DoD partners or to providers in the community to receive the care. We really do want to see more and more women coming to access VA healthcare. We understand them, and this is where they should be.
Hello, I'm Ron Lilly with the Pharmacy Service of the VA Maryland Healthcare System. We serve over 50,000 veterans and fill more than 2 million prescriptions a year. We have 2 full-service pharmacies, and we rely on knowledgeable staff and state-of-the-art technology to accommodate the high volume of prescription requests that we receive. You can refill your prescription in one of 3 ways: online through the MyHealthyVet secure website, by telephone using the prescription refill line, which is available 24 hours a day, and through the mail. You can also use MyHealthyVet and the telephone lines to check on the status of your refill. To request a refill online, you must register for MyHealthyVet at the website myhealth.va.gov. The system offers a secure online prescription refill service. To request refills by phone, just simply call our prescription line at 800-463-6295, extension 7395. To request a refill by mail, you just need to fill out and complete the refill request that you received with your initial prescription from the VA. Simply fill out and sign the refill slip, use the pre-printed label provided to mail the slip back to one of our pharmacies. All refills will be mailed directly to your home. We recommend that you order your refills as soon as you receive a medication in the mail, so that the next refill will be shipped out to you before you're scheduled to run out. You must order your refills at least 14 days before the medication runs out to receive your medications in a timely manner. Please note that we cannot refill prescriptions on the spot if you run out, since most prescriptions are mailed from one of our mail order pharmacies, so we encourage you to plan ahead. Some veterans may have a copay for their prescriptions from the VA, depending on their priority group or income status. Copays for prescriptions range anywhere from $8 to $9 for a 30-day supply of medication. When your prescriptions are out and you have no more refills, you will need to get a new prescription from your provider. Now, you don't necessarily have to schedule an appointment with your provider to get a new prescription. You can also request a new prescription online through the MyHealthyVet secure messaging option. Or you can call the prescription line at 1-800-463-6295, extension 7395.
Hello, my name is Rhonda Watson from Billing Services. The first thing you need to know about any bill you may receive from the VA is that there's a toll-free number right on the bill to call if you have any questions. You should also know that bills go out after services are rendered according to a set billing cycle, so there may be some time between your visit and when you receive the bill. While there is no monthly premium required to use VA healthcare, you may have to agree to pay some co-payments based on your priority group and income level. If you have insurance, it may cover the cost of the co-payments. In addition, VA is required by law to bill your private insurance provider for any care you received from the VA that is not related to a service-connected condition. Veterans receiving care for service-connected conditions will not have a copay, nor will we bill your third-party insurance for service-connected conditions. If you have any questions about a bill you have received from the VA, please call the VA Health Revenue Center at 1-866-393-0006. Thank you.
Hello, I'm Stacy Mangana from Emergency Services. The Baltimore VA Medical Center has an emergency department that is open 24 hours a day, 7 days a week. Rain, sleet, or snow, our dedicated team of board-certified physicians and skilled nursing staff are always ready and here to serve you. Our team is focused on providing you quality care and an awesome patient satisfaction experience, from the time you enter the emergency department to discharge or admission to an inpatient environment. An ED visit is very different from a scheduled appointment with a primary care physician or a wait in line at the grocery store. We know it's frustrating to wait when you're sick, but most people feel better when they know why it happens. We will do our best to keep you informed on reasons for delays. In 2015, we saw over 32,000 patients. That's over 100 patients in one day. Many factors influence wait times, and situations often change throughout the day. Our goal is to provide you with the highest level of care as fast as possible. Patients are not seen on a first-come, first-served basis. Urgent medical conditions will be seen faster than those with less urgent conditions. Those patients may not look as sick as you feel. If your condition worsens before you see a provider, please notify the front desk immediately. Upon your arrival, a nurse will welcome you and do a rapid assessment. We will register you and ask for your veteran ID card. You will then be seen by a triage nurse who will further assess you by asking additional questions and obtaining a set of vital signs. You will then be escorted into the exam room and asked to be seated until called by a provider. Don't hesitate to ask questions about your experience while in the ED. If something doesn't feel right, ask your doctor or nurse. It helps us to know your current medications and any allergies. We will ask you about that on every visit. If you need to see a social worker during your visit, please let us know. We also have an urgent care clinic at our Perry Point VA Medical Center, which is open Monday through Friday from 7:30 a.m. to 4:30 p.m. and is located in Building 361. You don't need an appointment for the urgent care clinic, just walk in. Urgent care is for non-life-threatening emergencies like fractures, sprains, minor wounds, urinary tract infections, bronchitis, or even the flu. If you are ever unsure about your condition and what type of treatment you should seek, you can call the VA telephone care line at any time of the day or night. If you need to make a same-day appointment, you can do so by calling the telephone care line between 7:30 a.m. and 4:30 p.m. Monday through Fridays. The telephone care line is 1-800-865-2441. Remember, for life-threatening emergencies, call 911 to be transported by ambulance to the nearest medical facility. Many of our staff are veterans or have service-connected family members. We thank you for your service and look forward to partnering with you for your medical care.
Hello, I'm Sherry Early from Medical Administration Service. In some instances, you may receive healthcare services provided by someone other than the VA. Just because you are enrolled in and are receiving care from the VA, it does not mean you cannot continue to see providers in the community if you choose to do so. We encourage you to make your VA primary care provider aware of any medications prescribed by a community provider or test results that you received outside the VA for your well-being. Please remember that you will be responsible for any cost for the care that you receive in the community that was not already or pre-authorized by the VA. If you need a service we can't provide at any of our VA facilities, your primary care provider can authorize you to be seen at a non-VA facility. If you are experiencing a medical emergency, you should immediately call 911 or go to the nearest hospital with an emergency department. You do not need to call the VA first, but as soon as you can, you should call 1-800-949-1003, extension 6980 to verify coverage. VA will cover your emergency room visit if you have a bona fide emergency, you have no other insurance, if your emergency is directly related to your service-connected condition, and you're actively enrolled with the VA. The Choice Program is a temporary benefit designed to allow veterans to receive care in the community if they are not able to get an appointment at the VA facility within 30 days, or if the veteran lives more than 40 miles away from the VA healthcare facility, including a VA outpatient clinic. This is covered in more detail in a separate video module about the Choice Program. If you have any questions about receiving care at a non-VA facility, contact Fee Services for the VA Maryland Healthcare System at 1-800-949-1003, extension 6980. Once again, that's Fee Services at 1-800-949-1003, extension 6980. And thank you for your service to our country. Hello, I'm Sherry Early from Medical Administration Service. The Choice Program is a temporary program that allows veterans enrolled for VA healthcare to receive their care from non-VA providers within their own communities rather than waiting for a VA appointment or traveling to a VA facility. Using the Choice Program does not impact your existing VA healthcare or any other VA benefit. To be eligible for the Choice Program, you must have been or will be waiting more than 30 days for a VA medical care appointment, or you must live more than 40 miles away from a VA healthcare facility, including a VA outpatient clinic. Participation in the Choice Program is voluntary, but care in the community is covered by the VA only for medical needs which have been approved by your VA provider. If you are interested in using the Choice Program, please call 1-966-606-8198 to coordinate your pre-approved care. You can also visit va.gov/OPA/Choice Act. Once again, you can call 1-966-606-8198 or go online at va.gov/OPA/Choice Act.
A variety of specialty care services are available through the VA Maryland healthcare system, including those you see on the screen. Patients are generally referred to specialty care by their VA primary care provider. Each consult is reviewed, and within 7 days the patient is contacted to schedule an appointment. If you need hospitalization, we have acute inpatient medicine units at both the Baltimore and Perry Point VA medical centers. These units include a coronary intensive care unit and a medical intensive care unit at Baltimore and a chronic ventilator unit at Perry Point. If you are admitted to the hospital, you'll most likely come to the Baltimore VA Medical Center, where we have 76 acute care medicine beds. Treatment is supervised by board-certified internists who also serve on the faculty of our academic affiliate, the University of Maryland School of Medicine. Providers also include residents, medical students, and postdoctoral fellows from the University of Maryland, as well as nurse practitioners and physician assistants, case managers, dietitians, social workers, occupational and physical therapists, and an exceptional nursing staff round out the interdisciplinary team. Veterans who are hospitalized usually come to us through the emergency department, directly from a VA outpatient clinic, or they are transferred from community hospitals or other VA facilities. We encourage enrolled veterans to receive all of their care through the VA when possible. Our providers and staff have a unique relationship with veterans. Many of our staff are veterans themselves, and we are familiar with the unique medical conditions that occur among our veteran population.
Hi, I'm Sarah Redding from the Mental Health Clinical Center at VA Maryland Healthcare System. The VA Maryland Healthcare System has a robust mental health program for veterans. We help our community of veterans who have experienced post-traumatic stress, military sexual trauma, depression, anxiety, bipolar disorder, schizophrenia, and more. We help address substance abuse problems, and we are there for veterans with suicidal thoughts or attempts. Our philosophy of care focuses on the whole health needs of each veteran we see. We take into account and acknowledge the challenges a veteran may be facing to support recovery. Our care model is moving to a less restrictive environment using a recovery-oriented, patient-centered approach to care. We emphasize community integration, and we collaborate, working together with the veteran and their family, as well as their caseworkers, peer support specialists, and any community healthcare providers the veteran may already have. We want to ensure your continued success. We offer many levels of care and numerous programs for mental health conditions. If you have a mental health concern, we advise you speak with your primary care provider first. Sometimes he or she can help you. Other times, you may be referred to specialty care as appropriate. If you ever feel like harming yourself or someone else, the Veterans Crisis Line is a confidential resource that is available 24 hours a day, 7 days a week for veterans, families, friends, regardless of whether the veteran is enrolled for care at the VA Healthcare Center or not. To contact the Veterans Crisis Line, please call 1-800-273-8255, then press 1. If you prefer, you can also connect with someone through text or chat. We welcome you to the VA Maryland Healthcare System.
I'm Dr. Herb Inch from Dental Care. Dental services are available through the VA Maryland Healthcare System, but eligibility criteria are based on very specific guidelines, much different from most other types of VA healthcare. In general, dental benefits are limited to veterans who have a service-connected dental condition, or a prisoner of war, or are receiving 100% service-connected disability compensation. To determine eligibility for dental services, you can contact the Eligibility and Enrollment Center at 1-800-463-6295, extension 7324. If you qualify for dental services through the VA, we have 2 clinics you can visit, one at the Baltimore VA Medical Center and the other at the Perry Point VA Medical Center. Thank you.
My name is Intisar Hassan from My Healthy Vet. My Healthy Vet is a secure website where you can electronically access your medical information, including appointments, lab test results, and prescription refills. You can also send confidential messages to your VA primary care and specialty teams through secure messaging on My Healthy Vet. To begin, you must first register for My Healthy Vet. Visit www.myhealth.va.gov and click on Register Today. Complete the form online and you'll be given a basic or advanced account, which provides limited access to the features on My Healthy Vet. Once authentication of your identity has been completed either online or in person, you'll have full access to all of the features on the site. It's not required that you use My Healthy Vet to receive your VA health care, but we do recommend you check it out. Full access provides up to 20 different features, and for those veterans who don't have a computer, we've made sure to provide My Healthy Vet workstations at all of our outpatient clinics throughout the VA Maryland Healthcare System. If you have any questions, please contact the My Healthy Vet coordinator at 800-463-6295, extension 7045. Thank you.
The VA Maryland Healthcare System has a special program to support service members returning from operations Iraqi Freedom, Enduring Freedom, and New Dawn. You may hear it referred to as OEF, OIF, and OND, but its new formal name is Transition Care and Management. Our focus is to help combat veterans transition back into civilian life. We take into account special needs that may be linked to your military service and coordinate your healthcare needs along with other related services to ensure that you receive the highest quality of care. Veterans who served in a theater of combat operations after November 11, 1998 can receive cost-free medical care for any condition related to their service for 5 years after their date of discharge. For care not related to combat service, copays may be required depending on a financial assessment and other special eligibility factors. If you have any questions at all, contact us at 410-605-7259. The Transition and Care Management Program is here to serve you. A social worker is part of your PACT. That's the patient-aligned care team that you are assigned to when you have your first primary care appointment. Your social worker is your connection to a multitude of programs and services. Your social worker can explain things about your VA healthcare, like what a service connection actually means. We are knowledgeable about what is offered through the VA Maryland healthcare system and can recommend which programs are good for you and your family. We will point you in the right direction, help you apply for various services, and while we're part of the healthcare side of the VA, we can help you understand and apply for benefits through the Veterans Benefits Administration, like the pension programs. If it's not a medical question for the doctor or a medication question for the pharmacist, your social worker can help. I encourage you to speak with your social worker about financial issues, transportation needs, even homelessness. These challenges can affect your overall health care and well-being. We can help either through VA programs or by connecting you to resources in your community.
Hello, my name is Dr. Abisola Meshoye and I'm from the Geriatrics and Extended Care Clinical Center. Aging is a natural process and we all age differently. The way you age is influenced by several factors, including your habits, past medical history, genetic makeup, and functional ability. On account of this, the geriatric care we provide is specifically tailored to meet every individual need. Whatever your aging experience is like, the VA Maryland Healthcare System's Geriatrics and Extended Care team will be with you every step of the way. For our veterans who do not have family members to be with them during this time, we become your family. We want to help you stay in your own home and live independently as long as possible. We can provide home-based primary care, home and community-based services, rehabilitation programs, and skilled nursing care to eligible veterans. In collaboration with the prosthetics department, we can also provide specialized home equipment like grab bars in your bathroom to help keep you safe. In geriatrics, the patient-doctor relationship often becomes the patient-doctor-caregiver relationship. Through our veteran-directed care program, veterans can determine who provides care to them and manage their own budgets. Their caregivers may even be eligible for a stipend so that they can continue to care for the veteran at home. The respite care program also provides support for the caregivers. When long-term care is needed, the VA Maryland Healthcare System has community living centers. An alternative to community living centers is the Medical Foster Home program, where you live in a private home with a qualified caregiver. We also have a specialized hospice program. Indefinite long-term care in the community living center is available at no cost to veterans requiring nursing home care for a service-connected disability, veterans with service-connected disabilities rated 70% or greater, or veterans who are 60% service-connected and unemployable. Most other veterans are eligible for nursing home care only if space and resources are available. Additionally, some veterans may be required to pay a co-payment for nursing home and other long-term care services. For more information, please call the Long-Term Care Information Line for the VA Maryland Healthcare System at 800-949-1003, extension 1121. Thank you for listening and welcome to the VA Maryland Healthcare System.
Hi, I'm Patricia Longard. I'm a nurse on the VA Maryland Healthcare System's telephone care line. Help is just a phone call away. Veterans can access the VA Maryland Healthcare System's telephone care line 24 hours a day, 7 days a week by calling 1-800-865-2441. Call one of our registered nurses for medical advice or to ask questions about your medications. The nurse can also answer questions about the various programs and services that are available throughout the VA Maryland healthcare system. You can also call the telephone care line to schedule an acute care appointment with a primary care provider. To request an acute care appointment, call Monday through Friday between 7:30 a.m. and 4:30 p.m. If you call after 4:30 p.m. or on a weekend, the registered nurse on call will provide medical advice but may not be able to make a clinic appointment for you. We make every effort to provide care promptly. Acute care appointments are scheduled within 24 to 48 hours. If your symptoms indicate an emergency, veterans may be referred to the nearest emergency department for care. When you need us, the VA Maryland healthcare system is just a phone call away. 1-800-865-2441.
Hello, my name is Wanda Shannon, and I'm responsible for the Release of Information Office at the VA Maryland Healthcare System. The Release of Information Office is where veteran patients' medical records are stored. You can visit the Release of Information Office at the Baltimore or the Perry Point VA Medical Centers to request a copy of your medical records. You will need to complete an authorization form as part of your request. If you would like to fill out the form before visiting us, please call 410-605-7348 for the Baltimore VA Medical Center or 410-642-2411, extension 6028 for the Perry Point VA Medical Center. You can also mail your request to the address shown on the screen. It can take up to 20 business days to process your request. Veterans are entitled to one complete copy of their medical record at no cost. They may also request individual items like an imaging report or a clinic note. Family members, caregivers, or someone designated by the veteran through an attorney with the consent of the veteran can also request copies of medical records. In some cases, the records you need may be located in another system. We can guide you to the appropriate area to obtain the information needed. An example of this is with radiology images. Please note, we do not keep copies of military records, including discharge paperwork, Form DD-214. You will need to request a copy of your DD-214 through the Veteran Benefits Administration by calling 1-800-827-1000.
Hi, I'm Ron Hoffman from the Patient Advocate Office. Patient advocates are available to assist all veteran patients, regardless of where they receive health care services throughout the VA Maryland healthcare system. Patient advocates can assist you if you have a problem receiving your health care services, or if you have a concern, a compliment, or a complaint about the customer service provided by any of our staff members. Patient advocates are VA employees who are specifically designated to manage the feedback received from the community we serve. Patient advocates work directly with VA management and employees to resolve issues. We strive to provide the best care possible in the most courteous and efficient manner. If a problem does develop during your visit or hospital stay, we encourage you to share your concern with a member of your treatment team or the nurse manager. Your treatment team includes your doctor, nurse, social worker, dietitian, pharmacist, chaplain, therapist, and other professionals associated with your medical care. If you feel your concerns are not being addressed by your treatment team, please contact one of our patient advocates. The Patient Advocate Program is here to give you and your family the security of knowing someone is available to focus on your individual concerns and rights as a patient. We work directly with all departments on your behalf and can address your questions or special needs in a timely manner. If you or a veteran you care for has not been able to resolve important healthcare issues with a member of your treatment team, please contact one of our highly skilled patient advocates at your VA facility.
Hi, I'm David Edwards from Public and Community Relations. There are many ways you can keep in touch with the VA Maryland healthcare system. Visit us online. Our website provides a wealth of information about the healthcare system, including descriptions about our programs and services, directions to each of our facilities, a listing of important telephone numbers, and a roundup of recent happenings. While visiting our website, be sure to like us on Facebook and follow us on Twitter to receive up-to-the-minute news and health tips. You can also click on Contact Us to reach the virtual help desk, which allows you to ask a question about our programs and services via email. Watch us on TV. The Veterans Health Watch cable show is an award-winning half-hour show that airs on local cable stations throughout the state. The monthly show includes information and interviews about healthcare programs and services available to veterans throughout the VA Maryland healthcare system, as well as providing a variety of health and wellness tips. Go to our website for the schedule and to view past episodes. Read about us. Now that you're enrolled, you'll receive a copy of the Health Watch newsletter mailed directly to your home twice a year. The newsletter will keep you informed about our programs and services and tips for maintaining a healthy lifestyle. You can access past issues of Health Watch on our website. Check your email. You can get information from the VA Maryland healthcare system delivered directly to your personal email account by enrolling for our e-news subscription service. To enroll, enter your email address under Subscribe to receive email updates on the homepage on our website. Give us a call. We encourage you to contact us when you have a question or need additional information. A listing of important phone numbers will be shown at the end of this video and is available on our website. Or come to see us in person. Stop by any of our 3 inpatient facilities or 6 outpatient clinics to ask a question or schedule an appointment. You can also join us for one of our open houses or town halls or a number of other special events and educational classes which are held throughout the year. To check on the dates and times of upcoming activities, visit our Events and Classes section at the bottom of our homepage on our website. We care about you and your health. That's why we have so many ways for you to stay in touch with us.